little bit about Blackpoint. Our philosophy is education. So we're going to teach Medicare beneficiaries the A, B, C's, and D's without regard to personal outcome and helping to grow our business. And by doing that, providing good to as many people as we can, we end up finding that we get many loyal clients and many referrals into our business, which has helped us to grow significantly. As far as agents and brokers go, we are looking for strategic partners, people who want to work with us side by side to grow their business, are willing to work hard and make the most of what they have available in their community. We'll help you design strategy, help you with tools, help you with marketing, and making connections in your area to ensure your continuous growth. We have a lot of experience in this space. At Blackpoint, we've been in the Medicare business for over 25 years. For me personally, I started out on the carrier side and was able to launch a very successful agency, Blackpoint Insurance. And I'm here to really help anyone to grow their business who is looking to always put the senior first in terms of everything they do. Now, working with brokers in general is a great deal because we work with multiple carriers in multiple areas. So we can really present to you what we believe is some of the better options available to you, not limited or restricted to just one company. Brokers don't charge any fees when you work with us because we get paid directly by the insurance companies when you enroll. Now at Blackpoint, the philosophy we're built on is only enrolling you if it makes sense for you. And that tends to pay off in the way of referrals and really building a great reputation out in the community. As agents and brokers, I prefer to work with other agents, and certainly our philosophy is Blackpoint, that are agnostic, which means we're not pushing one particular company over the other. We're doing what's best for the Medicare beneficiary, what meets their needs based on their doctors, their prescriptions, or how they want to access their care. We believe in creating customized solutions for each person. So whether you're an agent or broker learning to design your business, what are your strengths? What are your goals? Let's design that around you. If you're a Medicare beneficiary looking to enroll, what prescriptions do you take? The doctors you see? What's important to you in the way of additional benefits? We're going to help figure it out because there's no one size fit all for any kind of situation. And we believe in long-term relationships. So whether you're a Medicare beneficiary that's working with us every year and every opportunity there is to make changes with your plan coverage, we're going to be there for you every step of the way. And for agents and brokers, we're going to be that resource for you to answer your questions, help you service your clients, and make sure that you're always up to speed on everything that's going on with the industry. So with that, let's talk about Part D changes for 2024. Let's jump into the agenda. So first, we're going to talk about the two ways to get Medicare Part D. You can certainly purchase Part D through an agent or broker, go to medicare.gov, or buy it direct from a carrier. But a lot of people are surprised to find you don't really buy Part D directly from the government. So we'll talk about the two ways to get Part D and how that might apply to you or to your clients. Then I'm going to take you through the 2024 standard benefit design for Part D. Many things are improving in terms of standard design for next year. There's a few things changing negatively. So we're going to walk through those details and make sure you really understand what's happening with standard Part D design for 2024. Then we're going to talk through some key terms and concepts that you may hear about there. A lot of times we have industry jargon. It gets confusing for brokers and agents, just like Medicare beneficiaries. So we'll talk through some of those key terms and make sure you're feeling really comfortable. And then I'll give you more information on how to contact us if you'd like a pre-assessment about your current coverage situation. I'll get you connected with one of our agents or brokers. Or if you'd like to contract with us as an agent or broker starting out and growing your business, please contact us and we'll give you those details. So let's jump in. So first of all, how do I get Part D? A lot of people do think they're going to buy Part D just like they do Part B directly from the government. But Part D is purchased through private insurance companies. Now you can buy it directly from the private insurance companies through an agent or broker like one of our brokers at Blackpoint Insurance, or you can go to medicare.gov to sign up. However, you're not buying it directly from the government. You're buying it from one of the dozens of private insurance companies that are available nationwide to provide these types of benefits. You're going to purchase your Medicare Part D in one of two ways. Number one, you'll get it embedded in what they call a Medicare Advantage plan, otherwise known as Part C. In a Part C plan, you agree to assign your Medicare benefits, all of them, the A and B benefits, over to a private insurance company. And that private insurance company becomes responsible for 100% of your care and coverage. So you only use the ID card from the private insurance companies. Now, the reason that people would want to do that is some of these plans are available for low or no premium. And although they include a network of doctors that you have to use in terms of benefits for the plan, and in the case of HMOs, you have to get referrals to specialists. If you're happy with the network, not only do you get low or no premium, but there's lots of bonus benefits, things like the prescription embedded, dental, vision, hearing, and more. Now, each year you can add or change these plans during the annual election period, which runs October 15th to December 7th, and changes made for these plans during this time are effective January 1st of the following year. Now, there are some cost shares called copays, which is when you pay a set dollar amount, or coinsurance, when you pay a specific percentage of the bill with Medicare Advantage plans. So you're going to be wanting to be careful to explain to your clients or work with your broker to make sure you understand any share of cost and what the maximum out of pocket will be. You'll also want to evaluate the names, dosage, and quantity of any prescriptions you take and make sure they're on the plan's formulary or drug list, and make sure they're at a competitive cost and copay for your situation. You also want to be very careful about the network. Make sure the primary care or main doctor you want to see is part of the plan, and that your participating specialists are also included and aligned with your primary care physician, so you'll have no problem with your access to care. The plans that are available are not the same in every single region. They can be different, even at the county level, at the state level. So you want to really be careful as an agent or broker to know the plans that are available in the area that you're selling, be communicating compliantly about those plans, and then as Medicare beneficiaries, being aware that everything that you see on TV may not necessarily apply to your given area. Now, the great thing about Medicare Advantage plans is during the annual election period, you've got guaranteed acceptance, you've got a valid election period to make these plan choices for a January 1st effective date. Now, the second way to get Part D standard design coverage is with a Medigap and a Part D standalone plan. Now, some people just do Part D by itself. Most of our clients also choose to pair it with what's called a Medigap or a Medicare supplement plan. So you're doing ABC Medicare Advantage as option one, or you're doing AB, Medigap, and D. When you do this, you actually have 3 cards instead of 1. You're using your red, white, and blue Medicare card as your primary insurance at the doctor, lab, or hospital, and you're using your Medigap or Medicare supplement plan, like a Plan G or a Plan F. You're using that carrier's card as your supplemental insurance. So you use your red, white, and blue Medicare card and your supplemental card at the doctor, lab, hospital, and so forth. You're also buying what they call a standalone Part D drug plan from one of the private insurance companies that offer standalone drug coverage. It doesn't have to be with the same carrier that you're getting the Medigap plan from. You can buy it from any carrier that's offering Part D, and they're all following Medicare standard design for drug coverage. Now, what's not so great about this combination of plans as compared to a Medicare Advantage plan is that there's higher monthly premiums, and they do go up every year as you age. But the great thing is you have the flexibility to choose the doctors you want to see. You don't have to get referrals. And as long as those physicians take Medicare, you're able to go to them. There's also very low out-of-pocket costs medically when you use these types of plans. But remember, that can be offset by the higher premiums that you're paying. Part D, of course, is not just included in a Medigap plan. You have to buy it as a separate policy. And when you buy Part D, you have opportunity to change it every single year between October 15th and December 7th for a January 1st effective date. So if your prescription drug needs have changed, or if your plan has changed, this is the opportunity to reevaluate and consider another option for the next plan year. It's also an opportunity if you're on Medigap and D, if you wanted to consider Medicare Advantage, you could switch during that time period. Now, you do want to be careful with that, because if you leave a Medigap and a D plan to try an Advantage plan, it may require medical underwriting or health questions to get back on this type of option. A big exception that we talk about this time of year is something called the trial right. So if you're kind of fed up with your Medigap premium and your Part D prescription plan being expensive for the year, and you've never tried a Medicare Advantage plan before, You can try it for up to 12 months. You can leave this combination of plans, try a Medicare Advantage plan, and if you don't like it, you can get it back without going through the medical underwriting. So the Part D and the Medicare supplement, you can get it back using the trial right, as long as you've never been on a Medicare Advantage plan before. So be very, very careful about that. And as long as you change back within 12 months, anytime within that 12-month period. So sometimes when Medigap beneficiaries are scared of trying a Medicare Advantage plan, there is this way to give it a try and see if it works for you and your situation. Just like Medicare Advantage, Part D, for the prescription component, you have your opportunity to change that plan every single year, even if you're suddenly taking significantly more medication coverage or needing more medication coverage. Let's talk about your Medicare coverage. Scan Health Plan is for people with Medicare, and that's their sole focus. They're known for their award-winning service, and that's really what sets them apart. Scan has the comprehensive all-in-one coverage you need, plus the extra benefits that might surprise you, and the exceptional service that you deserve. It's time for a better Medicare Advantage experience. To learn more about Scan, please visit scanhealthplan.com or ask about Scan from your local agent or broker. Thank you. Part D standard design. What does all this mean? Well, the interesting thing is when you open up a Medicare Advantage booklet or you open up a standalone drug plan booklet, they all look fairly similar. And the reason for that is they're all following Medicare standard design for drug coverage. So they can choose to enhance Medicare standard design, but it can never be any worse than Medicare standard design. And so that's why when you look through the booklets, everything looks pretty similar from carrier to carrier. But things can be dramatically different, like the copay for a specific medication, the list of medications they cover, and what tier they put those medications on. Also, the plans are star rated on a quality scale from 1 to 5. And that's going to be a way to help measure where you're going to potentially get a better experience when you're working with that particular plan. So at any rate, when you open the plan's booklets, they're all looking pretty similar on standard design. So phase 1 of 2024 standard design for Medicare Part D is what's called the deductible phase. A deductible means you pay this portion before the coverage kicks in. The standard deductible for 2024 is $545. That means if the company you go with is only going with the standard design, the first $545 would be out of your pocket. This begins January 1st, 2024. The great thing about the Medicare Advantage Part C plans is most of the plans, not all, but most of them waive this deductible. It's one of the enticements they try to do to grab your attention and make you want to go with that plan type. So they'll waive that deductible. So that's a perk. To get a plan, a Part D standalone drug plan that waives the deductible, you're looking at some of the higher premium type plans available on standard Part D. For most of the relatively lower cost Part D plans, waiving the deductible doesn't usually happen for tiers 3, 4, and 5, which are considered the brand name drugs, but often does get waived from what are called tiers 1 or tier 2, and in some situations just from tier 1. So tier 1 medications are typically your preferred generics. Tier 2 are your non-preferred generics. Tier 3 is what's considered brand name preferred. Tier 4, non-preferred brand name. And tier 5, injectables. However, the medications that each plan puts on each tier can be different from one company to the next. And that's why it's very, very important to be thorough with your clients, understanding the names, the dosage, the quantity, the frequency, the type, whether it's a capsule or a tablet. All these things can make a difference in determining which plan has those medications on their formulary at the lowest possible tier and at the lowest possible cost. And that really brings us to phase 2 of Medicare standard design, which is what's called the initial coverage limit, or the ICL. I like to think of the ICL as a bank account for prescriptions for the calendar year. So for 2024, Medicare is depositing $5,030 in your bank account for prescriptions. However, this isn't the portion that the Medicare beneficiary pays or the portion that the plan pays only. It's the combination of both. So, for example, your client's taking a prescription that retails for $600. Their copay may be only $40, but the full $600 is coming off of the ICL. Now, the carriers do a great job of keeping beneficiaries informed of how much they've used of their bank account. And fortunately, majority don't go over this initial coverage limit, but some do. If they go over the ICL, which in the example I gave would happen around the 8th month of the year, then they go into phase 3 of Medicare's standard design called the coverage gap. In the gap, typically the beneficiary is going to pay 25% of the cost of the drugs in the gap. So that means that $600 medication is no longer a set copay, it's now a coinsurance of 25%. Now, in the gap, the drug manufacturer is also giving the government discounts. So they may reach 25% or pay 25% of a lesser amount. The true out of pocket spending, a lot of people will say, is there any way out of the gap? And if the true out of pocket spending of a beneficiary reaches $8,000, they move on to Medicare Part D's catastrophic phase. So, a couple things to point out for this year. The MOOP, and this is what I was referring to with the drug manufacturer discounts, it's difficult to spend $8,000 out of pocket. That's pretty frightening for a lot of your potential clients. But the drug manufacturer discounts also go towards the MOOP, and they can vary widely. When you use one of the search tools at Blackpoint, we work with Sunfire Matrix. We can look up and see with some good degree of certainty when a beneficiary is going to get the gap. There's plenty of other tools out there, including Medicare.gov, but you can give them a reasonable estimate of when they'll hit the gap and then when they'll actually get out of it. Because usually people don't actually have to spend the full $8,000 to get to the catastrophic phase. Usually what happens is the impact of those drug manufacturer discounts dramatically reduces the true out-of-pocket cost. The great thing for 2024 is if you have clients that reach the catastrophic phase, which means they've reached that true out-of-pocket level of $8,000, either on their own or a combination of the drug manufacturer discounts and their own spending, at catastrophic for next year, there's 0% coinsurance. That is a dramatic improvement over this year where it continued to be 5% for the rest of the plan year. So now your beneficiaries that are on those high-end, very expensive medications can have a true maximum out of pocket, which is wonderful news. Now, it's important to keep in mind that the average cost for Medicare's Part D standard benefit for this year was around $32. Next year, that's going to probably go up significantly because of the impact of covering much more medication and reducing the coinsurance in the catastrophic phase. So that's something that we can be looking at, and it's probably going to impact some of the plans that we're looking at for next year. Now, I wanted to review a few key terms and concepts for you. Now, one of the most important things that you need to be educating your clients on, and if you're a beneficiary, you need to know about, is for those people out there that say, hey, I don't take any prescriptions, I'd rather just skip taking Part D. I never recommend that, and neither do any of our agents and brokers. And the reason for that is because of a potential late enrollment penalty, or LEP. The LEP is 1% penalty of the national average premium for each month you didn't have Medicare Part D and you were supposed to. So imagine a beneficiary doesn't have Part D for 24 months. That would be a 24% penalty based on the national average premium. So right now, that'd be 24% of $32. But next year, that's going to be 24% of some higher amount. And it doesn't go away. So it continues to increase as the national average premium increases as well. So this can be high impact for your clients. And there's some very low cost options available. If you get Part D embedded in an Advantage plan, you can sometimes get it for no cost. And there's some very inexpensive plans, at least currently under $20, that they could have that would just be that placeholder for Part D to avoid any penalties later on. Plus, you never know what might happen throughout the year. If you don't have a Part D drug plan, if something happened, you wouldn't be able to add it until the next annual election period. So really important for all of those reasons. The next key term that I wanted to go over is something called IRMA. IRMA stands for Income Related Monthly Adjustment Amount. And basically, these are high earner taxes that the government assesses based on your income from 2 years prior. So right now we're still in 2023. The government is looking at your 2021 modified adjusted gross income to determine if you're a high earner. How it works for this year is that if you're an individual and your income was above 97,000 that year, or in a married couple and it was above 194,000 that year, you're assessed these high earner taxes automatically. It doesn't matter if you're buying your Part D through a Medicare Advantage plan at no cost, or you're buying it as a standalone drug plan. If you're assessed in IRMA, it's based on your income, and they're going to charge that on your Medicare bill or deduct it from your Social Security if that's how you're paying it. It also fluctuates each year. So in 2024, it'll be based on your 2022 income. So if you have highs or lows on your modified adjusted gross income, it could affect your high earner taxes. There's also an exception process for this if you've had an income change for a qualifying reason from the year they're reviewing. So you can always contact us for more information on that. The next key term I wanted to go over is LIS, or low income subsidy. This means that a person might qualify for extra help on prescriptions depending on their income and assets, and it can either reduce or eliminate your share of cost on a specific medication, and it can reduce or eliminate a monthly premium. So if you think you may qualify for LIS, be sure to ask your agent or broker about it. And if you're an agent or broker, there's tools that you can easily help people apply online for LIS. And if they have an LIS indicator, you can put that in your search, for example, in the Sunfire tool, and it'll show you exactly what the copays will be. Just because they're on LIS, you still need to make sure you're looking to ensure the medications they're taking are on the plan's formulary or their drug list. Star ratings, super important. They get released each year. They have to be communicated on every sales appointment or interaction when you're enrolling someone in a plan. These help beneficiaries measure the quality of the health and drug plans being offered. Now, for this year, for 2023, Part D plans only really had a 3.5 out of 5-star rating. I'm hoping to see improvements on that for next year. Some of the Medicare Advantage plans that are out there have 4, 4.5, or 5 out of 5 stars. So all things being equal in terms of the drug list and the copays you'll pay, getting a higher rated plan means that the quality of the health and drug plan being offered has been measured by the government as being of a high standard. So that's something really important to look at along with the other components here. Now, we throw around industry jargon a lot, but an important term that you're going to learn about is formulary. I like to call it the preferred drug list. It's simply a list of covered medications for a specific plan. But it's really important to note that just because one company offers a medication on a certain tier doesn't mean another one does. I talk to Medicare beneficiaries every day, and sometimes people say, well, I'm not worried about prescriptions because the ones I take are low cost. You can't just assume that when you're moving to Medicare Part D. It's important to evaluate those and make sure that your share of costs will be the lowest possible on the highest possibly rated plan. So really important to review that. There's certain copays for each level, and ensuring that it's a plan or coverage that's going to meet your client's needs or meet your specific needs in an exceptional manner. Now, there's always room for exceptions. There is a formulary exception process. So if you need something that's not on the plan's list and nothing on the plan's list will work for you, there's a process called prior authorization, which can make exceptions directly with the plan. I always say I prefer in a formulary exception situation to be with a higher rated plan because, again, they've demonstrated working with beneficiaries, working with you as you help to support them to ensure we get those approvals. Now, these aren't guaranteed. The plan has to approve it. But I can say in my experience, if it's based on medical necessity and there's not an alternative, they happen all the time. But it's not something that you would want to expect as the rule. It definitely is a permission type process, and the plan does have to approve it. And medical necessity is going to be key. Now, transition supply is something what happens when you switch from one Medicare Advantage or one Part D plan to another, and the new plan doesn't have your prescription on the formulary. You can get a one-time 30-day supply of the prescription you were taking prior to switching plans. Quantity limit is another key term you're going to want to know about. Usually, if a medication requires prior authorization or PA or has a quantity limit or QL, You can see those indicators right on the prescription plan finder tools or on the carrier website. And this is generally the highest amount of a prescription that can be given by a pharmacy for a period of time. So sometimes people are on medications that are considered addictive, this type of thing. A quantity limit can be instituted. Maybe it's a very high cost plan where a quantity limit is indicated to make sure that people are using that medication before getting a refill. So there can be a lot of different reasons for it. They can be sometimes removed through the prior authorization process, but some of them cannot, right? If they're considered addictive medications and that type of thing. So just something that you want to be aware of. Make sure that you educate your clients on this process so they don't have any surprises when they get to the drugstore. And for all you Medicare beneficiaries out there, understanding what this means to have as easy access as possible to the medications you need. And a lot of times people will ask me, well, what about preferred pharmacies? Preferred pharmacies are pharmacies that typically are going to offer lower copays on your plan, whether that's Medicare Advantage or standalone Part D. What I can tell you is things are really changing for 2024. The really good news is that we are seeing more enhanced prescription drug standard design benefits than we've seen in many, many years. So the elimination of the 5% coinsurance in the catastrophic phase is a huge enhancement for your clients. But what that means is the cost of standard Part D is going to be going up. It just is connected one-to-one relationship. You may have clients that are going to be looking for lower cost solutions. It's possible that they'll want to look at a Medicare Advantage plan. Some of the Part C organizations are great choices because they embed Part D as part of the benefits. But remember, it's a completely different type of plan than a Med Sup with a Part D combination. There's usually a network of doctors. If they're on an HMO, they're typically going to need referrals to see specialists. You also need to be careful about trying the plan, that if they don't like it, you're able to move them back within that 12 months during the trial, right? I really think this year is going to be a year where people are looking at those alternatives. So you just want to make sure that you're presenting those, you're educating, and making sure people know all their options as they move into 2024. I want to thank you for your time today. I hope you got information out of this. It's certainly by no means a complete list of everything available about Part D. I'm just attempting to simplify this a bit and make sure that you get the information you need. If you need more insight and would like education on this, contact me. You can go to blackpointinsurance.com and fill out a contact me form. If you're an agent or broker looking to contract or just have a question, no obligation, you can certainly reach out and we'd be glad to help you with that. If you're a Medicare beneficiary that needs a pre-assessment, please let us know and we'll be happy to reach out to you. Thank you.